Myths and realities about piles. Piles are so common today. Almost one person in every family at some stage in their career has been diagnosed to have piles, which in Hindi we call Bawaseer and in Marathi we call Mulvyaadh. In Latin they are called hemorrhoids. But basically they are swellings of blood vessels at the lower end. You can sometimes feel the swelling. The patient often has bleeding. Patient often has pain, but it's possible to have piles without bleeding and piles without pain. So it's not that all symptoms should be together. If you have these symptoms, you suspect that you have piles and you must see a local doctor. Remember, the same symptoms are often found in colorectal, that is large intestinal cancer. We see large intestine cancer in India increasing rapidly and being seen in younger and younger patients. We have seen patients as young as 14 years of age without family history who we have diagnosed to have a colon cancer. So symptoms of colon cancer are bleeding in the stool, weight loss, mucus, and most importantly, they often have a family history because some of them can be hereditary or familial cancers. So I'm repeating the red flag signs for you. If you suspect you have piles, but you have mucus in stools, you have alternate diarrhea, constipation, if you have weight loss, or you have family history of GI cancers, it is a must for you to see a specialist who will probably do some simple tests like a proctoscopy, which is done on an OPD basis, where he or she can see the lower rectum. He can do a flexible endoscopy, which also is a test to insert a fine tube like a camera through the bottom end to look for the cause of bleeding and then make appropriate diagnosis. Remember, most piles patients don't need surgery. They need change in diet, some laxatives and local ointments. The few patients, hardly 5% of piles need surgery, and those we do nowadays with a laser treatment. This laser surgery can be done on OPD basis. Patients can go home either the same night or the next morning. There are no sutures, there are no cuts, and patient returns to work in 4 to 5 days. So why are you scared of piles? Why is there such a stigma about discussing this? Please meet your local specialist if you have any of these symptoms. Get diagnosed by doing an endoscopy and get quick, effective treatment done. Thank you very much.